InnerQuest explores various pathways through which you can connect with the infinite wisdom of the universe and apply it to personal, professional, and spiritual growth. This program, featuring accomplished practitioners, educators, and authors, is provided by Infinity Foundation, an innovative center for holistic studies and research. We invite you to share this journey with us.
Hello, welcome to InnerQuest. My name is Jay Stone, your host for today, and our guest is Dr. Mary Farhi. Welcome, Dr. Farhi.
Thank you.
Dr. Farhi is a board-certified obstetrics, gynecology, board-certified in obstetrics, gynecology, integrative, and holistic medicine. She completed Kripala's 200-hour yoga training and Yoga Bent's Mighty Body Band. Is that what this is over here?
That's what that is.
Yes, and you mentioned earlier before the show that your husband is
the inventor.
Oh, the inventor.
The
We've got to have him as a guest.
Yes.
Dr. Farhi's approach is to educate and empower patients on creating wellness and vitality. Just a few minutes before the show that we talked, you are very impressive. So I'm looking forward to this interview. Tell our audience, what is functional medicine?
So functional medicine, I like to think of a couple different ways. You can think of it as more of a systems biology approach, or as I like to think of it, as more of a model that I use to incorporate integrative medicine. So more traditional approaches would be someone has a symptom, you may decide to treat that symptom sometimes with medication or surgery or different things. And what functional medicine with that systems biology approach does is really tries to get to what is the root cause. Mm-hmm. So I like to tell patients we're really going upstream to try and uncover what is the root cause of perhaps the symptom that they're experiencing.
Did you see patients today?
I did.
Can you think of a patient where you use functional medicine today?
I can think of several.
Okay.
So I'll give you an example. Since I'm a gynecologist, oftentimes women come in complaining of perimenopausal or menopausal symptoms like hot flashes or night sweats. Mm-hmm. And I like to say menopause has, kind of gotten a bad rap because the first thing we do is oftentimes women are in their 40s or 50s, they're experiencing these symptoms and it's like, oh, it must be menopause. And so my approach to this patient today was really trying to take a step back and talk to her about her whole life. Mm-hmm. And what's going on. And oftentimes with women who are experiencing these symptoms, it may be that menopause was enough to tip them over. It's like your cup was full and you have a little bit more hormonal disruption with menopause and it's enough to tip you over. But you got to that point without a lot of what I call physiologic reserve. So one of the most common things in our, kind of crazy go-go world is that people's adrenal glands get fatigued. Mm-hmm. And so women who have a lot on their plate and they've been burning everything at both ends for all these years hit menopause, and those are the women who struggle. So the patient today, what we're going to do first is address her adrenal gland function and then, expand out looking at her other hormones. And
so do you take into account diet and lifestyle?
Absolutely.
Okay.
So the other thing that functional medicine does is we use what's called a timeline where we actually go back and talk about, what was your mother's pregnancy like? Were you born by C-section? Was it a vaginal birth? Were you a child who had a lot of strep infections? Were you somebody who was on a lot of antibiotics? Because that whole story, that whole timeline is what, got them to wherever they are at that point with their current concerns.
Now is functional medicine something you learned in medical school, or
no?
You want to talk a little bit about how you started with functional medicine?
Sure. The first course that I went to right out of residency was what was then called complementary medicine in Santa Fe, because I think 24 years ago I thought something's missing. I had a great education. I'm very grateful for being trained here, but I just knew that there was more to it in terms of the mind-body connection. And so through the years I've studied that. And it was actually at a training I did with John Kabat-Zinn where I met someone who said, you'd really be interested in functional medicine, and I hadn't really heard of it, so I started exploring it. So the Institute of Functional Medicine is a group of people who really have organized this movement, and at Cleveland Clinic, they just opened the first functional medicine clinic run by two of the pioneers of the Institute of Functional Medicine, where they're studying 4 chronic diseases to look at outcomes. So this will be the first time, and very exciting to really have some measurable outcomes for the functional medicine
And what are
approach.
those, do you know what the 4 chronic diseases?
Diabetes, hypertension, probably cholesterol, and maybe obesity. I don't remember exactly. But,
Yeah.
the 4 big chronic.
Well, I've heard physicians say that most diseases and illness can be treated with diet and lifestyle changes.
Absolutely. So I didn't answer your question about do I address diet and lifestyle, because that is absolutely, I tell patients all the time, we have to use food as medicine, because there's no bag of supplements that's going to replace a diet that is not containing the nutrients and things that your body requires. Now sometimes we do need to supplement with some things, with some different nutraceuticals. For instance, people can have different genetic mutations. They're called SNPs, single nucleotide polymorphisms, that can affect how our body can actually absorb nutrients. And so some people might require certain specific nutrients based on those SNPs.
And I would assume that there's some medical tests that lead you to prescribe
Absolutely.
something.
Absolutely. Absolutely. So oftentimes we'll start with that timeline, and then as we go through, there are some specialty tests sometimes that we do, oftentimes starting with the gut. Heal the gut.
Why the gut? Why
Well,
start with the gut?
So we think of the gut really as our second brain.
There's actually a book by that title.
And I haven't read it, but it's I've heard that
The
that
second
term,
brain,
yeah. So our gut is really amazing, and I think we are at the tip of the iceberg of what we're learning about our gut and the physiology of our gut. And 60 to 70% of our immune system sits underneath the gut lining. So when you think of our skin, how many layers our skin has to protect us from the environment, but your gut is 1 cell layer thick, only
Yeah.
one. And it has a lot of what are called, they're like involutions or microvilli that increase the absorptive area, but it's still 1 cell layer thick. So if 60 to 70% of your immune system is sitting underneath that 1 cell, and maybe because of chronic antibiotics as a child, or acid blocking medication, whatever it is, or poor dietary choices, that gut line, or celiac disease, or things like that, food allergies, that gut lining starts to become what we call leaky, and those tight gap junctions can start to separate, and so that the proteins then start to leak through, and your immune system recognizes it as foreign and starts inflammation and autoimmune disease and all these things.
Yeah, I would assume somebody is not has poor digestion, metabolism, fatigue as a result of a leaky gut. Do you actually see improvements with people with leaky gut?
Oh, absolutely. So there's a program that we use in functional medicine called the 4R, or sometimes people call it the 5R program, where we remove. So the first thing oftentimes is we'll put people on an elimination diet that's really not a diet in terms of calorie restriction or trying for weight loss, but trying to help identify what foods they may be sensitive to. Because there's a lot of different tests out there to test food allergies, but none of them are perfect. So I think the best test is real food in a real body. And so we'll remove, and then we replace. So some people need digestive enzymes. Then we'll re-inoculate. So oftentimes people need probiotics. And then we repair using different things to help repair the gut lining.
But by the way, the name of the author of the book, The Second Brain, is
Yeah.
Dr. David Gershon.
Okay, I have heard of it, yeah.
Yeah,
I haven't read it, but-
Gershon.
Yeah.
And I believe he's he's a Yale medical
Okay. I will read
physician.
that. Thank you.
Yeah. Lots of good stuff
Yeah.
you have. What about integrative medicine? Can you say a few words on integrative
Sure.
medicine?
So I think I think integrative medicine is part of the whole functional medicine. I think of functional medicine as the model to use to integrate this holistic approach, because we are used to, in again traditional Western medicine, to have these silos of ologies. You know, you go to the gynecologist, you go to the cardiologist, so we're very it's like these individual silos of where you go versus taking a whole look at the patient. So I think holistic medicine is looking at the whole, all those systems together is number one, because oftentimes a patient may go see one ologist and have something done and the other ologist isn't really aware of it.
Well,
so looking at all that.
I love this doctor once said, I forget who said it, he says, specialists know more and more about less and less.
Well, and I think time, I mean, there's a lot of challenges in practice today, but the other piece of holistic or integrative medicine is incorporating all of those things. So just to say to somebody, well, I think, your cortisol levels and things with your adrenal glands are not working well, but then giving them the tools for their toolbox. So how do you reduce stress? So bringing the yoga piece in. I have an acupuncturist that works with me in the office. Some women benefit greatly from acupuncture, all the mind-body techniques that we can use. So trying to bring all those pieces in to help that patient achieve vitality.
Now, as far as leaky gut, are women more prone to get leaky gut, or men, or does it kind of fall evenly?
I don't know the answer to that. I tend to see women, so I don't know.
Well,
I would imagine it would be.
Well, well, let me ask you: does pregnancy have an adverse effect on a woman's gut?
No.
Okay.
I don't think pregnancy per se, but remember, in pregnancy, our immune system is somewhat suppressed, because that's how we don't reject a fetus. Our immune system is a little bit suppressed. So no, it wouldn't have a negative impact. I think really it's more, what are you eating? What is your lifestyle? All those things have a much greater impact.
Okay. And how does integrative medicine differ from traditional gynecological care for women?
So I think the example I gave of the woman who was complaining of menopausal symptoms, one approach I could have said, okay, here's a prescription for some hormones, and that'll definitely help your hot flashes.
And that would be the traditional approach.
That would be a more traditional approach. And not everyone uses hormones. There's controversy even about that. I had another patient that I can think of a few months ago who came to see me she was interested in bioidentical hormones because she'd gone through menopause a little bit early, in her mid-40s. But her biggest complaint was her fatigue and her joint pain, and she'd actually been to several rheumatologists that had been recommended to put her on a very strong medication that's actually a chemotherapeutic agent, but it can help people with arthritis. And she was hoping that maybe bioidentical hormones would help her. And my gut feeling was that...
That's second brain.
That we could definitely balance her hormones a little bit because she was young, but that there was more to the story. So I said, will you be willing to try this elimination diet? And she was looking at me like, why is this woman asking me what I eat when all I want is some hormone, balancing? So we did start her on a little bit, and she did agree to try it, and she came back in 3 weeks, and she said, the first week I thought, I'm not sure. The second week I thought, my God, I'm feeling better. And she said, 2 days ago I ran up my steps for the first time and started crying because I feel great. And she was gluten sensitive. She stopped eating gluten, and all her symptoms went away. Now,
it's a great story. When you start this process of elimination, of the removal,
right.
Do you have clients keep or patients keep logs so they can track things?
Absolutely. So it's very spelled out. Again, it's through the Institute, and it's about a 26-page handout that I give them that really explains why. Because I think that's the other thing that's so important with patients is patients love to understand why they're doing something, or love to understand why we're recommending something. I think when we just say, here, go do this, then the compliance may not be as good. So I think it's really important to empower people with information so they understand and buy in. So I had a patient today who tried the elimination diet, and she said, well, I'm not sure I can do that. And I said, okay, well, how did it go? She said, well, I felt great. My energy was better. And I said, oh, so what's the... And for her, she felt it was restrictive. So we kind of walked through that this wasn't her being good or bad or anything like that. It was really all about how she felt. And by the time we finished that conversation, I think she had a much better understanding. And she had bought into, she was doing it for herself, not for me.
Well, we're trained to just kind of go along and, the doctors are the experts and follow what the doctors say. But what I'm hearing you, or at least interpreting, is like you're saying, no, you've got to listen to your body. Your body knows what you need. Follow your body.
Yeah. I think that we've all spent a long time not listening to our bodies. And I think if we really take the time to be mindful and listen, oftentimes we know that answer.
And you mentioned an institute. Is that where you work at? Is it?
No. So the Institute of Functional Medicine is where I've been training. So you had asked about how So the Institute of Functional Medicine has courses throughout the year. So I've been doing their different modules. So every 3 to 4 months, I travel, and I've gotten to know a lot of these people really well. And we spend 3 days talking about biochemistry and the Krebs cycle and a lot of things that I've learned about in medical school, and I thought, I never will need to know this. But it's so relevant to really understand. So we do a lot of studying. I do a lot of studying at home and a lot of reading.
Well, and it's very inspiring to me, and I hope our audience, to realize how much of a lifelong learner you are, and it's knowledge to help your patients. It's quite impressive.
Well, it's an honor.
This is a question. What do you think men need to learn about gynecological health?
Wow, that's a great question. I think that I would maybe rephrase that a little bit. I think that oftentimes, again, there's this perception that, I've had patients come in and say, my husband wanted me to come in because he says something's wrong with my hormones. Mm-hmm. And so I think we tend to focus so much on ovaries as all of the hormones for a woman. And I think we forget that it's not just the ovaries, but it's our adrenal glands. Sure. It's our pancreas and thyroid. The insulin production. Yes. It's the thyroid. Sure. It's fatty tissue. Adipose tissue secretes hormones. So there's this whole big picture, and we can't just focus on, it's, the week before her period, it must be this, So I think for men, just understanding that oftentimes, stress can play a big role in women's health. And sure. I think women tend to take a lot on.
Mm-hmm. I would agree.
Yeah.
I would agree. All right. Why do some women suffer from severe menopausal symptoms, such as hot flashes, while others sail through with minimal symptoms?
I think you know the answer to that now.
Well, could you want me to try?
Sure.
Diet, stress, lifestyle.
Yeah. So again, I think
But I would think genetics play a role in it too.
Yes. But I'm always so interested in women who, I'll see a woman for her annual visit, and maybe I haven't seen her for a year and a half, and during that time her menstrual cycle stopped, and I'll say, you're now in menopause. How do you feel? Fabulous. Having hot flashes. I had a couple, but no big deal. I feel really good. Mm-hmm. And then I have some women who come in their late 40s who are really, really struggling, and I love this concept of metabolic reserve. I think for men and women, if we kind of think of this, as we go through life in our 20s and our 30s and our 40s, are we generating and are we building metabolic reserve, physiologic reserve, so that when we have these fluctuations or illnesses in our lives, is our body able to have that flexibility to respond and heal again? Mm-hmm. And so I think for a lot of women, they get to menopause, they've been really for those 20 years depleting. It's like their bank
Sure.
account. They're not putting anything in their savings account, and they're taking everything out of the bank. So then they get to menopause, and that reduction in some of those hormones creates enough imbalance that now it tips them over and they're bankrupt. So they have there's nothing, because once you go through menopause, it's not that your hormones stop, your ovarian function declines, still makes testosterone, but the estrogen and progesterone declines. But your adrenal glands are like your sump pump backup system. This is when they take over. So if your adrenal glands are like, can't do that, can't take over, I think those are the people who are more symptomatic.
And so with adrenal glands, what are some of the treatments?
Well, the first thing I like to
reduce the stress.
Right. But the thing is just like the thyroid, you mentioned the thyroid glands can be overactive or underactive,
Sure.
correct?
Hyper.
Right. So the adrenal gland, again, it's either not normal or abnormal. That's kind of we tend to put it black and white. So Hans Selye, back in the 60s, wrote a book called The Adaptation Syndrome, and he was the one who kind of started looking at the adrenal glands. And
Relaxation Response was bestseller.
yeah, so he looked at, there's almost 3 stages that he described of adrenal fatigue. So in the first stage, the adrenal glands are overactive, and so you would want to you can give different herbs that can actually kind of quiet the adrenal glands. And in the second stage, so your other hormone your adrenal gland makes is DHEA, which is a pro-hormone to your sex steroids. So in the first stage, both are overproduced. In the second stage, your cortisol is still too high and your DHEA is starting to fall. And in the third, fatigue, they're both kind of flatlined, because a normal cortisol curve should be this beautiful highest in the morning, comes down at night. And so the treatment really depends on where they are. And so you need to you need to look at that.
And so there's a test that reveals it?
Yep, we do your saliva and blood tests correlate pretty well. And since you need an early morning and a late night, you can't really, your doctor's office isn't going to be open. So normally we would do a salivary test where you take 4 tubes home and, produce saliva and freeze it and mail it into a company.
And how long does it take to get the results back?
2 to 3 weeks. Yeah. So it's very interesting.
Good. You frequently give public lectures on balancing hormones and creating vitality. What are some of your lectures' important tips?
Well, I will tell you that I did one with my husband at the Schomburg Library about 3 weeks ago. And we titled it Reducing Stress, Creating Vitality in a Mini Yoga Class. And we had 96 women sign up to come to this, and men. It wasn't just men.
Okay.
So again, we talk a lot about lifestyle and trying to use stress reduction techniques and try and teach some pranayama, some breathing techniques. And we, taught a few basic yoga poses for people of all.
And what do you think, what are some of the yoga poses you like to recommend? Basic starters.
I think that really depends on who it is. Because whether it's a younger person or older person, limitations. But what I like to tell people about yoga, because so many patients will say to me, I'm not flexible, I can't do that. So I like to explain that yoga actually has 8 limbs, and the physical postures really are only one piece of yoga.
Right.
So my favorite thing is to teach them breathing techniques that they can do at home, and to start with pranayama.
Okay. Good.
Because that they can access anywhere.
Sure. Even while driving a car right before road rage.
I don't recommend usually doing it when you're driving, but...
And what are the top 3 things people can do to reduce toxicity in their bodies?
That's a great question. I think...
Well, before you answer that, let me ask this. What's the detriment of having toxicity in the body?
Well, our body is definitely designed to handle it, right? That's what our liver does. Our liver has a detoxification system. And so if we have too much toxicity, we can overwhelm our body's natural ability to detoxify that. Or we don't support it enough, we can deplete the system doing that.
Well, one of the things, I don't know if this is true, but I find like if you put toxic things in the body's using its energy to get rid of the toxins instead of using the energy to work or play or socialize.
Or to heal or to,
yeah.
right, absolutely.
Yeah. Okay.
So it is. I mean, we have when you think about, you're exactly right. Energy production, when you think about food, we talked about food as medicine, so we consume healthy foods to produce energy in our body. And so if that energy needs to be diverted to constantly be trying to detoxify your body, absolutely, you're not going to have energy for all the other things, for sure.
So the 3 toxicity tips?
Well, I think looking at your food is super important. I think trying to do organic, at least with certain things. So the Environmental Working Group, EWG.org, always updates a list called it's now the Clean 15 Dirty Dozen. I don't know if you've heard of that. So those are the 15 fruits and vegetables that are the cleanest, and then the Dirty Dozen is the 12 with the highest pesticide residue. So if you only have a certain number of organic dollars, try and make sure that the Dirty Dozen is the ones that you purchase. So through your foods, through our, if for people who do eat meat, trying to do grass-fed or organic to again reduce the hormone exposure in our body that we're going to get. One of my big things that I tell people all the time is the plastics. Plastics are just a really big thing in our environment that people don't think about. I can't tell you how many people I've seen coming in who are drinking a lot of water bottles.
I got my glass bottle.
Right, I use my glass. So I think we don't realize how much endocrine disruption plastic is. And I see that oftentimes in women who are struggling to get pregnant, and we get a lot of that toxicity out and their ovaries start to function better, and many of them have conceived.
Well, the women that I know that were planning to get pregnant, they were doing everything they could to cleanse their body. And so you find that in your practice as well?
I think it's a matter of education. Not everybody knows, that plastics
I agree.
are a problem. And a lot of people are actually surprised that, when they hear that. And, so now we have this BPA-free, but the things that they're using for the BPA-free plastics, they're now coming out with studies showing that those are also endocrine disruptors. So I think we just have to stick with the glass bottles.
Yeah. Well, I think we have about 30 seconds. Anything you want to top off your conversation with?
No, I just think, I think that I would like everyone to know that they have the inherent ability to heal their bodies and live a vital, healthy life. I think it's really important.
Well, thank you, Dr. Farhi. For more information about InnerQuest Infinity Foundation, stay tuned to the credits at the end. Until next time, we wish you good health, good fortune, and good spirits. It's been a pleasure and honor to speak with you.
Thank you.
For more information about this show, our guests, Infinity Foundation, or any of our other programs, please visit our website, infinityfoundation.org, or call us at 847-831-8828.